Good morning, everyone. You guys couldn't see me, but I was doing a little dance in my chair during the video. Such a great way to start the Saturday. So my name is Paulette Gardiner Millar, and I'm the president of the Ontario Physiotherapy Association. I'm so pleased to welcome you all to InterACTION Online 2021. As part of reconciliation efforts with Indigenous peoples, First Nation, Métis, and Inuit, I'd like to begin by recognizing the original stewards of the Anishinaabe and Haudenosaunee territories from where I'm currently broadcasting. In gathering for this event today virtually, I acknowledge that we are all on different traditional territories. We take this time now in recognition of the presence of the Indigenous peoples, both past and present, and give thanks for the opportunity to come together for this event on these lands. There are approximately 400 of us at conference this year, including colleagues from BC, New Brunswick, PEI, Quebec, North Carolina, as well as over 150 physio students. And we all have a very exciting day to look forward to. There are over 30 speakers, 2 keynotes, a fantastic closing speaker, as well as 10 concurrent sessions. Check out all the speaker bios in the Socio platform or on our conference landing page. We also have a virtual research competition with 25 research projects on virtual display and a full virtual exhibit hall with a scavenger hunt and chances to win great prizes. I also want to take this opportunity to thank everyone who has worked to make InterACTION 2021 happen. This includes the OPA Board of Directors, OPA staff, the Education and Awards Committee, and Fanta Media. This is a first for OPA to go fully virtual, and we have such an amazing experience planned for you. Please be sure to check out the OPA social wall to show your professional pride and spirit. Monitor the announcements for up-to-date information on activities that are happening throughout the day. Without further ado, we are pleased to have with us this morning Dr. Joshua Tepper, who will be speaking to us about leadership during a time of change. Having heard Dr. Tepper speak at past Health Quality Ontario events, I have no doubt that he will jumpstart the day and get us thinking. Over to you, Dr. Tepper.
Good morning. Good morning, everybody, and thank you so much for having me today. It's really such an honor to be part of your conference, and I think a really timely opportunity to talk about leadership. And so I want to start with just a couple opening comments. First of all is, although I currently work for the government and work at some hospitals and stuff, I'm really here just today representing myself. I have no conflicts of interest that I can identify. And I want to be very mindful that for me, thinking about this topic of leadership during a pandemic, like these are reflections, not truths. And you may listen and sort of violently disagree, and that's sort of good and healthy. And really, this is just a chance to, I think, to share some thoughts about leadership. And I think each of us in our own ways are providing leadership. We're providing leadership in our communities. We're providing leadership for our clinical practices and for our patients. And so how we think about and act as leaders and take a few minutes this morning to think about the acting of leadership is really important. And I think, sometimes when I give talks, it's really about driving change. But my goal today is less about, to try to lead a charge towards something new and different, and more just to try to virtually collectively, meditate a bit on the acts of leadership. What I'm going to be talking about in leadership are not unique to the time of COVID and to the time of a pandemic. But I think there are elements or aspects of leadership that have really been accentuated or further brought to the forefront because of the pandemic we're in. And then the final thing is I just want to thank people for being here today. First of all, it's early in the morning, so thanks for joining so early. But more importantly, I think there's a huge need for connection. This is a really hard time. It's been a hard year, and it's been a really hard week here in Ontario. We've seen tremendous sort of challenges to our vaccine rollout, which is something we all have such hope for as a path out. We have seen our case numbers climb to unprecedented levels. And to say that we're setting new records is something. Unfortunately, we see our healthcare system, which we're all part of as healthcare providers and professionals, in sort of remarkable stress. So I congratulate and I thank the OPA for creating a space where we can get together, where we can be a community, where we can talk about leadership and other issues that face us as healthcare professionals who are very much at the front lines of this difficult pandemic. And so thank you individually, and thank you to the association. I want to talk about sort of 4 or 5 balancing acts that we need to do as leaders. And again, I don't present them as truths. I don't present them with an answer about how to find it, but I just want us to acknowledge them, and in acknowledging them and being more present of those tensions, being able to strive or at least be self-aware of those balancing acts. Of course, the pandemic, I think, as I said a bit in my opening, has asked us to come to the forefront, I think, as leaders. I mean, it's powerfully moving to walk down a street and see people like yourselves and myself as healthcare professionals being hailed as heroes, to be thanked. But I think it is also pressure, right? For every beautiful sign, for every clanging of the pots and pans at 7 p.m., for every note of gratitude, for every time we're turned to formally and often informally from friends and families and neighbors for advice, because we are, as healthcare professionals, on the front line of this, there's also a rising up and a raising up of our leadership expectations. And it's really tough. And I just want to acknowledge that many of us as healthcare professionals have found ourselves sort of thrust into a bit of a leadership role or a limelight of leadership by the pandemic in ways that we haven't previously. And like I said, often in very informal ways, but the informality of a neighbor or a friend or a family calling you for advice doesn't diminish that feeling of burden and responsibility. And again, many of you have formal leadership roles as well that have become even more challenged. So one of the first challenges, I think, is this difficult balance between, I think, leading with data and leading with emotion. And, you know, one thing we have had, I think, as a strength of our pandemic, at least in Canada, is a remarkable amount of data. We are inundated with data. I think people around us, our patients, have more information about the pandemic than they have about any health situation they've ever faced in their life. And, you know, it's the obvious things like the number of cases a day, but my patients and the organizations I lead and the staff and the team members I lead, they know how many variants they are. They know the vaccine types. They know side effects. Like, we are inundated with data in a way that we haven't been before. And at the same point, we're also inundated with incredibly powerful emotive stories. And we're these sometimes stories of tremendous hope and success, and sometimes stories of loss and failure and death. And as leaders, one of our most critical responsibilities is communication. You know, that is one of the most important acts that a leader has, is to communicate. And so structuring your communication to find this balance of numbers and emotion, of data and what I'll call the softer side of communication and the stories, I think is really one of the challenges. And I think being mindful of the power of each, but also the numbness that can be created if you do too much of each is really an important thing to sort of be, to think about. Because if we just, you know, the numbers can be numbing, and, you know, really overwhelming for people who are trying to keep up with you as leaders, who are trying to keep up with what's happening. But similarly, we can get lost in just individual stories and lose the big picture if we just focus too much on one patient, one case, one example, and not be able to contextualize it in the larger picture and the larger data slide. or the, not slide, but the larger data framework that we're in. And so figuring out how to find that balance between data and story, between individual case, individual anecdote, that one patient, versus the overall sort of framework of data, ICU beds, ventilator beds, closed clinics, open clinics, case counts, vaccination rates, case rates per 100,000, all of these things, variant B117, P1, et cetera, et cetera. That, I think, is one of the tremendous tensions. And there's no, as I said, right answer in these tensions, but it's to be mindful of leaders of how are we weaving and moving between these balancing acts of sort of individual anecdote, case, emotion, and the power of emotion, and grounding ourselves in the hard facts and the hard data and the hard numbers that are coming at us fast and furious, and that are probably more available if you look a little bit than ever before. The second challenge I think that we really have as leaders is balancing the certainty, uncertainty, confidence, humility, tension, balance. Because one of the things people want from their leaders is they want certainty, they want confidence, they want a confident leader. There's many people who say, I don't care if you're wrong as long as you're certain. And one of the hardest parts for people in the pandemic is uncertainty. It's incredibly corrosive to have uncertainty. And so to have leaders express uncertainty can be deeply dissatisfying and, in fact, deeply anxiety provoking. We know that many of our patients would rather be given a clear, bad, terrible diagnosis than to be told we're just not sure what's going on. Not all of them, but often we know our patients crave the certainty, even if it's a negative outcome, even if it is a bad prognosis or a bad diagnosis, they want that certainty. And we look and we know from studies that people crave leaders who provide certainty and confidence. But on the other hand, the reality is, as leaders, we're facing tremendous uncertainty, and we need to lead with humility, and we need to acknowledge that there are often more unknowns than knowns, that things are well beyond our power, that it's hard to predict what's going to happen and when it's going to happen. And so leading, whether it's with an individual patient or a team or an organization or an association, and trying to communicate confidence where you can, certainty where you have it, but also being able to communicate humility in the face of just unprecedented, and it's become sort of this cliche, unprecedented, and the uncertainty is really, really challenging. And I think just something to be mindful of. And I think it's okay as leaders to acknowledge this tension to people who are looking to you for leadership, for people who are following you, and to articulate the balance that you're trying to find. I think it's okay. I said to people, I'm confident on this, but I'm deeply uncertain on that. And it's okay, I think, to be transparent about this balancing act. And I think leaders who err too much on the side of either one of these are going at risk of losing followers. If you can't provide some degree of certainty, it's very hard to lead. If people feel you're constantly uncertain, that you can't provide a path, if you can't provide any sense of direction, that's really not the leadership they need. On the other hand, anybody who goes out with total confidence is going to almost certainly find themselves wrong more often, wrong often, and risk lose followers. So I think this is just another tension to be really mindful of, again, whether it's you're leading teams of hundreds or clinics of dozens, or just with an individual patient. We have much less certainty than on many conditions and situations than we have before. We're still learning so much with the variants and the long haulers and the vaccine escapes and the vaccine supply and some of the complications and the treatment options and what works and what doesn't work and what works for mildly ill and very ill. And so how do we find this balance? One of the greatest things that leaders need to always do is balance the looking in versus the looking out of the organization. I always say that, again, one of the great, one of the roles, critical roles that a leader has is communication. One of the greatest ways of implementing that communication is by communicating outwards versus communicating inwards, taking information from outside, communicating it in, and taking information from inside your team, your unit, your association, your whatever you're leading, your committee, and pushing it out. And this challenge of finding the internal, external focus of your attention, of your time, of your energy is really hard, because if you're all inside, you're going to lose a lot of the information, balance, perspective, and context that your organization needs from you as a leader if you're always inside. On the other hand, this is a time when your organization needs you more than it's ever needed you before as a leader. And if you're always out, meeting with other people, learning from other people, out in committees, trying to soak in what other people are doing, how are they doing it, what are they doing over there, what are the rules, what's the college, what's the regulator saying, what's the federal government saying, what's the provincial government saying, what are the journals saying, what are the scientists saying? If you're always out there trying to soak that in and learn from it, then you may be at risk of neglecting your own team, who, like I said, needs you more than they've ever needed you before. And so finding this balance is particularly hard because of the intensity and the pace of change. And so the ability to manage your time and to recalibrate your time in a very fluid way, facing inwards, leading inwards, versus being outwards and being in that broader leadership community that you float in, is really, really important, and I think really, really challenging. And again, something to be mindful of, because both are so consuming and so intense and so needy right now that it's easy to lose our situational awareness. It's easy to lose our contextual awareness of where we've spent and are spending our time. And so I think, even stepping back at the end of each day, if not at the end of each week, and sort of saying, how much of my time did I spend with my team, with my patients, focused inside versus outside, listening to other data points, other experts, other committees, other sources of information that guide you and inform you and position you as a leader is really, really important. And then there's the strategy and the tactics balance. Many of us as leaders, of course, like the strategy part. That's often why we came into leadership roles, is we like the big picture. We like thinking about, how do we lead? Where am I going to take the organization in 5 years? Where do I want this group, this team, this clinic, this committee to be in 5 years, 3 years, 10 years? What's the big picture? And that's often why, as leaders, we're drawn to leadership roles, is the strategy. But there's also, of course, our ability to execute. There's our ability to actually deliver on promise, to deliver on vision, to hit those benchmarks, to make the pivots and the changes that we see and we've outlined in our strategy. And whereas often we are working on 3-year or 5-year cycles of strategy tactics, we take a year to set a strategy, we take a half a year to set out how we're going to implement it, and then we take a couple of years to tactically implement the strategy and then sort of start the cycle over. We're having, as leaders, to balance this strategy tactics almost daily and certainly weekly, because the environment is so fluid. Because the situation is changing so incredibly fast. And in many ways, we are far more tactical and operational, and pivoting to the operational nuance of, how do I simply get the hand hygiene sanitizers up? How do we get patients through in a timely way? How do I triage the most acute to the least acute, because I can only see X number of patients versus Y number of patients before? How do we get PPE supply distributed broadly? How do we deal with somebody who's sick? We are much more tactical and operational as leaders than many of us wanted or thought we would be. And yet we can't completely lose track of the overall strategy. Like, how are we going to be fiscally solvent as a team? How are we going to think about the ongoing onboarding, training, education, research mandates, all those other more long-term strategic things? So they can't completely fade away, but they're likely diminished disproportionately to what our normal leadership roles would be in strategy relative to the operational pressures that we now have to pivot to. And also because a lot of the strategy work is being driven by larger forces and larger command and IMS structures and command structures than before. So I think this is another really important balancing act that leaders are going through, and a recalibration of what many of us as leaders normally find as a balance between those two. Two final thoughts. First is, as hard as we try to balance on that tightrope, we're going to fall. We will have failures and we're going to have falls, and we are going to be unsuccessful in finding the right balance between the ones I've talked about and many other ones that I don't have time to talk about. And so the question or the proposition I have for you as leaders is, how are you going to be ready? What are the safety ropes that you are attaching to yourself now, so when that fall comes, you're going to be safe? What are the professional and personal safety ropes that you are putting around yourself for the falls that are going to come? How are you going to be resilient in the face of failure, which as leaders inevitably is going to happen at any time in your leadership career, but particularly now in the pandemic? I cannot think of a leader in the healthcare system who has not had clear, distinct moments of failure. And I spend a lot of my time with healthcare leaders. Some of the failures have been, and I would say I can't even think of a prominent leader in healthcare who hasn't even had what I'd call a significant or major failure. I'm not talking about small, but every leader I can think about has had major moments of missteps and failure. And so one of the most important things we need to do is to prepare ourselves, to prepare our teams, our organizations, the people we're leading for the failures that will come under our leadership, and sometimes directly because of our leadership. And how will we prepare them for resiliency and ourselves for resiliency? Because if failure is inevitable, and I think it is at any time, and particularly now, we really owe it to ourselves and to our teams and to our groups to build in and be prepared and to be resilient so that we continue to get through this. We can't let failure and the falls that we experience really keep us off our game. And I would also say, as hard as this pandemic is on leaders and leadership and the balance of leadership, it's also a time for tremendous growth. It is also a time where we can really aspire, where we can learn, where we can push ourselves in new ways, where we can develop new skills and new competencies, where we can find new connections as leaders. And I think, this is a talk on leadership, and hopefully many of us, and all of us actually, will be better leaders at the end of this difficult pandemic, whenever that end comes, than we were at the beginning. And in fact, not just at the end, but through the process of this pandemic, grow and continue to sort of evolve our leadership capacities and abilities. And my hope today was, by bringing our attention to a few of the balances of leadership, and allowing us a few minutes at the start of a fun and important Saturday conference to think a little bit about how do we grow as leaders by thinking about the balancing acts that we're constantly facing each and every day, by thinking about how are we going to be resilient as individuals, as teams, and as organizations in the inevitable failures, and to allow us to grow. A lot of people say they're just getting through. And I think getting through is not good enough for leaders. We actually have to thrive and grow and evolve and develop. And I think that is one of the challenges we should lay upon ourselves as leaders, is that growth opportunity, not at the end, not later after the pandemic, but throughout the pandemic, to become better leaders for the people who need us. So I'm going to close there. And often, I think the most important part of these conferences is the conversations. And I'd love to have some chats and some questions, and to work together for a few minutes in the time that remains for this session to have some back and forth. And so I'll turn it back over to our wonderful moderators and leaders to sort of engage in a bit of conversation in the time that remains.
Hello, everybody. Feel free to put some questions or comments in the chat box. There's been lots of great interaction while you were talking, Dr. Tepper.
Okay, I couldn't see it, so I'm glad to hear it was there.
Yes, there has been lots. Here we go. So balancing fear of failure versus needed risk, so many unknowns, but how do you keep fear of failure from preventing you from taking the needed calculated risks that's needed by leadership? Good question, Dorian.
Yeah, I love that question. And hi, Dorian. I think, fear can be paralyzing, and the fear of failure can be really paralyzing. And one of the things people turn to leaders to is action, right? And so I think the key word is, to some degree, calculated risks. And the other word that I would use is communicated risks. I think what you want to be is, you want to be conscious of the risks you're taking. You want to be deliberative in the risks you're taking. And I think you want to communicate the risks, just as you would with an individual patient on a treatment plan. When you're making organizational or leadership decisions, you want people to know, partly to manage their expectations, partly because it's how you build their own resiliency, is by letting them know, and partly because it allows for you to develop contingency. Because one of the things you want to do is say, okay, if X happens, this is my response. And so the more mindful and purposeful you can be about the risks and communicating those risks, the more you can sort of say, and this is my contingency plan. This is how we're going to resolve. This is how we're going to pivot, and actually position your organization for those potential failures. And say, if this happens, this is collectively what we're going to do. And so communicating, planning, articulating those risks, I think, are really, really important. And so you cannot be, you don't want to rush, but inaction is not a choice in the face of this pandemic. Paralysis of the fear of failure is not an option for leadership at this point. It's how do you anticipate, communicate, and mitigate.
Mm-hmm. Love it. Thank you. There we go. There you go. Sandra's agreeing with you. Reflections, the tip balance strategy versus tactics are spot on.
Yeah, and it's really frustrating, right? Because most of us who got into leadership roles, we did it for the big strategy, right? Like the questions were rare, like, how will you operationalize ... It's often, what is your vision? How will you lead? How will you create change? What are the 3 things you want to see in 5 years? Those are the interview questions we got as leaders. And now you're being forced down to, like, how do we move from 10-minute appointments to 20-minute appointments? How often are we checking the hand sanitizers to make sure they're full? These are not the glorious things we thought we were taking on when we signed up to be president. But those are the tactical things we need to do without losing the fact there is still strategy to be done. There is still strategy and an aftermath, and even a current strategic decisions that need to be made. And you can't lose yourself in those. So thank you, Sandra.
Mm-hmm. Yeah, I totally agree. We all, I think we all started as operators to some extent, right? Getting things done. So we have to keep our eyes on both sides, because you can get sucked down each if you're not careful. All right. From Kathy, what is your favorite way to recharge as a leader in order to face the next day with courage? Good question.
That's a wonderful question. And, I think For me, it's a combination of both drawing and recharging from my group, from my professional world, from redrawing from my personal world, and redrawing from my inner world. And I may not use all three each and every day, but over time it's a balance. There are times when, there's just nobody else who really knows what I'm going through and how hard it is than my peer leaders or my senior team. And I turn to that senior team, I turn to peer leaders, I turn to my professional world to help me recharge. There's other times I turn very much to people who have nothing, who wouldn't know a hospital if it didn't have a big blue H on it, right? Like if it didn't say hospital, they wouldn't know it was a healthcare. And I turn to people from completely different parts of my life, people who are just friends who know nothing about what I face every day for the distance in the space. And then there are other times where I just read a book, or I go for a run or a walk, or I listen to a podcast or something. Very, very internally focused. And I really do revolve around those. And I also think in doing that, what I'm doing is sometimes I'm looking to recharge by seeking answers for what I need in the job and what is drawing me down. And other times I'm recharging by creating space and distance from what it is that is drawing me down, and trying to actually be very mindful of this and very deliberative. And so, I think one of the things you want to do as leaders is not just to be mindful of the act of recharging, what it is you're recharging, we have many batteries, right? We have physical energy level batteries by sleep and food and physical vitality. We have intellectual batteries. We have emotional batteries. Which of the batteries need recharging, and what are the best ways to recharge those different batteries? And because often we can just feel ourselves uncharged, but not clear exactly why. And so, Kathy, it's a great question because it encourages us to be mindful about the path of recharging. Because sometimes you think, I'm just underslept, I'll just go to bed early, and you wake up no better because it actually wasn't the sleep battery that was uncharged or that was leaving us low.
100%. That self-awareness is so important. And I think taking a moment to actually sit and think about what is it that I need to work on right now, and then moving in that direction wherever it is, and recognizing that will be different from day to day. What I need today is probably different than what I needed yesterday. And that's okay, right? That's great. Thank you, Derek. The pace of development of challenge, success, failure, pivot cycle as a leader during this prolonged crisis is something that tests one's resilience and supports, that's for sure. Can you expand on keys to keeping your team motivated and intact?
Yeah, so, I think first of all is carving off space and time for the act of leading and the act of leadership for your team. And so, Peter Drucker once said you should spend 90% of your time on the act of leadership and 10% of your time thinking about the act of leadership or working on the act of leadership. Like today's session, right? Like today's session is actually to try to create space. And so I think one thing you want to do, perhaps even more than normal, whereas normally you might do once or twice a year, bring the team together to think about, how are we functioning as a team? And you do that once or twice a year. We actually need to create that space for thinking about the act of leadership versus acting as leaders much more often. So we need to physically carve out this space to be thinking and talking about leadership with the team more than ever. Because it's very easy to just get sucked into the constant work and not thinking about what are we doing as a leadership team, how do we stay motivated and intact. And so first of all is acknowledging the need and creating the space when time is so limited and the pressures are so high. The second is, I think, turning a bit to the team and asking them, because it can be so individual, and creating psychologically safe spaces, creating different ways, surveys, outside consultants, outside experts, rotating the chair of the committees, like using a lot of different ways to bring different ideas forward in a safe space so that people can really talk about what they need and communicate what they need, because there'll be different things at different times. So how do you really, A, create the time and the space, and B, allow that time and space to be a true space where people can share what they need and you don't make assumptions. And the third is setting aside resources. People are going to need to people are going to need supports they didn't need before. And so I know money is never enough and resources are never enough and all that, but how do you actually find a way to carve out the budget to create a little bit of time for what people need to stay motivated and for the team to stay together? And sometimes you can find those online resources and they're free, or you can tap into other people or whatever. And sometimes you need to make those investments. But I think the fact you're asking the question means you're thinking about it. Then you need to create the space with far more frequency. Then you need to create the space to have the psychologically safe space to learn and to hear and to nuance. And then you need to actually find the capacity and the resources dedicated to making those investments, because asking people what they need and then not delivering is a tremendous risk and failure of leadership. I mean, you can't do it all, and you have to manage that, but you need to be able to make that plan.
Mm-hmm. For sure, couldn't agree more. I know in the team that I'm leading currently, a group of clinicians who are managing physio clinics out in the community, and when I have my one-on-one calls with them, I think it's important to first identify as people. We're people first. Like, how are you doing? And I'm asking because I actually care about how you're doing. We're going to actually spend some time talking about that because it's important. And I think it opens doors for other conversations and determining other needs. There you go. Carve an authentic space for leadership and team engagement. Revisit resource allocation. Perfect. That's great. Thanks, Derek. Jennifer, what kind of safety ropes do you recommend for the falls?
Those are great. So there's a bunch. And again, I would divide them up personally and professionally. And in the professional world, I divide them up by what I would call organizational or broad structure versus individual. And so you really do want to think about, how do you prepare organizations for failure? How do you think about, and when I say failures, they may be unavoidable failures, let me be clear. But, when I was leading the hospital, we talked about having our first COVID patient enter the hospital weeks before the first COVID patient entered the hospital. And we talked as a senior team about what it would mean to have the first healthcare professional in the organization be infected with COVID weeks before we had our first infection among our team. And we talked about what it would mean and how we would respond to our first death of a patient from COVID weeks before it happened. So a lot of this is about preparation for the fall, having open communication. We did not want to be writing about the first death of a patient the day it happened. And in fact, thank goodness it never happened, but we didn't have a death of a staff member. But we talked a lot about what we would do, how we would support, how we would communicate, how we would reach out, what are the teams we would bring in, so a lot of it is about thinking ahead to what are the falls and how are we going to be ready? What are the resources we will bring to bear? What are the words we will use? Who will we turn to for help? What external and internal capacity will we have? And again, it's a bit like, and getting people psychologically ready is incredibly important, because it's the surprise, or even if it shouldn't have been surprise, what feels like a surprise is so damaging, and it slows the path to resiliency for you and the team. If you can imagine a negative outcome, you can prepare for it. When it happens, the path to resiliency is shortened a lot. And so those are some of the professional safety ropes that I set up. Remember, people don't clip a safety rope onto their harness in free fall. They clip a safety rope, they clip the safety rope onto them when they step out onto the platform. They don't do it as they're falling off. They clip it when they first step out onto the platform, and even before they step out. And I think that's an issue of timing, as well as some of the things I do. Scenario planning, right? It's all about scenario planning, and putting those resources in those capacities is huge professionally. Personally, I do a little bit of the same thing, right? You know, when you're having casual chats with friends and when you're doing this sort of what I call routine recharging, is often you're setting the path and setting the safety network personally so that when you then really need somebody, you've already built that support structure. It's very hard to call somebody you haven't necessarily leaned on in 9 months and say, I'm having the worst day, this terrible thing happened, ... And the more you can do the small things with your team, it can work. I'm not saying it won't, and we all have those people who will drop everything. But the more people are contextualized to your reality, the more those personal supports are there as well. And the other thing is their habits, right? Like, and take exercise or sleep. If you haven't been having regular exercise and sleep, and then the wheels come off and you're down and you're crushed, it's very hard to suddenly say, well, I'm going to start getting more sleep today, or I'm going to start, exercising today. The worst time to start trying to improve your wellness and put those things in place is in the middle of a crisis. It can be done, but it's so much harder. But if you've always been sort of trying to take those 20-minute walks 3 times a day, when you really need those walks 3 times a day, once a day, a 20-minute walk once a day, then it's suddenly easy when the falls happen to really dig into that and maybe move it up to twice a day. And so building those patterns in a modest way personally allows you to really rely on those patterns heavily when you are in free fall. And otherwise what happens is they're hard to use, and we tend, in full bluntness, to turn towards things that are less healthy, like alcohol, bad foods. We reduce our sleep instead of having the healthy things in place that we can then dial up, because we didn't have them really in place at all. So we can't turn and dial it up when we really need them. So again, it's a bit about clipping the safety ropes in before you fall.
Mm-hmm. Carolyn Gill. So I'm hoping that coming out of this time, many more leaders and organizations have a much better sense of being vulnerable and really acknowledging the tensions that we were just talking about. Given your comment about leaders been seen to fail, which is how we learn, for sure it is. Have you seen a change over time in how leaders are leading?
Yes and no. I think we have seen some of our leaders cry more openly. I think we have seen some of our leaders talk more openly about loss, talk more openly about challenge. And I think the other thing that I've really noticed in this pandemic is I've seen leaders talk much more about the mental toll and the mental health issues. I think we have seen much more open conversation about the mental health impact on our patients, but really on frontline healthcare professionals in ways that I've not seen before. There's much more investment, the Great White Wall, the big way, like there's just been much more investment in resources, in open conversation and open discourse about the mental health benefit. In other ways, I probably have not seen as much discussion from some leaders, even in the face of failure, of acknowledging those failures and not of acknowledging them. Some I have, some I haven't. So in some ways, I think we have seen some nice evolution of leadership and acknowledgement of leadership. In other places, there's, as always, it's a journey, and there's always more to do. But I do think one of the greatest successes in leadership has been the willing to acknowledge the mental health toll that this is taking on the front line and on our teams. And I think that's been really positive. That has been better.
Mm-hmm. That's great. Thank you. How have you found the mounting engagement on social media regarding healthcare has had an impact on how you lead?
Yeah, I mean, I think it's been really important in sort of 3 ways. First of all, just from pure knowledge, you can learn a lot. And so, following scientists and journals and websites and like it's been a tremendous source of data and information. I started using it for my clinical practice a long time ago and learning a lot. So it's been those are very, very useful tools. The second thing I will say is it can be a tremendous source of support. And you can find a tremendous sort of peer support and emotional support, and we're all in this together, and it can be a tremendous place to connect and to broaden your circle and to be uplifted by photos and stories and words of encouragement. But I think you also have to balance it with 2 or 3 risks of social media. So one risk is you create an echo chamber and you just hear the people who sound and look like you. And so one thing I do is I follow people from across the political spectrum. I follow naysayers. I follow people who are vaccine skeptics and vaccine hesitant. I follow people who have very diametrically opposed views from me. I follow people from countries who are taking very different approaches than Canada. And so I really try to avoid the echo chamber risk of just listening to people who sound and think and say what you already know or feel or the data you already have. So I try to really follow or broaden, number one. Number two is there's a lot of negativity on social media, and you have to watch out for the trolling and the criticism, and I've been attacked and all that. And you have to figure out how much of that you can take and when you unfollow, when it's constructive and true and something to listen to, and when you shut it out. And the third is it can just be a time suck. You know, it can just be a massive time suck, and we don't have a lot of time as leaders. And so how do you contain the sort of relentlessness, like the use of social media as people have been locked down, like the number of tweets a day, posts a day, Facebook likes and posts a day has just soared. Like you just can't keep up. So how do you sort of manage your time and balance the use? And so, you know, I never did. And people say, oh, now's the time to get in. I'm like, no, this is definitely not. So I never was on Facebook. And even though everybody said, oh, there's such good stuff, I'm like, no. And LinkedIn, I actually used to use LinkedIn quite a bit. I've just shut it down because it's just too much right now. So I use one, and I've never been on Instagram. I don't take good photos, obviously. But like, you know, so I really focus on one platform, and I really just try to think about how do I use that to greatest constructive benefit. So there's some real benefits that I've outlined, but I also want to highlight those risks as well of echo chambers, time suckingness, and some of the negativity that exists. And you just have to balance all those great positives I mentioned with those negatives.
Mm-hmm. Great points. Camila, as a student, I've noticed that the educational system generates a fixed mindset where people measure their worth based on their grades. How do you think as a leader is the best way to nourish a growth mindset in others?
Camila, that is such a thoughtful point and such a good criticism, not just of the educational system, but of so many things. I think one of the things you have the privilege of doing as a leader is setting the definition of success. One of the greatest privileges we have as a leader is setting the corporate scorecard. It's setting the goals. It's setting the metrics. It's setting what we will define to our board, to our CEO, to our VP, to our team as this is what success looks like. And I think trying to really step back and think about what are the measures that matter this is a great opportunity to do that. You know, how do we sort of think about measures like what percentage of people took time off in the last month, right? What percentage of people, how many of my one-on-ones did I really have that committed to that I actually found time to make and actually make sure that we created that really good time that you talked about at such important times. So I think this is a time to redo it. And if you're not in a position, and I know often as students, we're not in, having been a student for much of my life, then I think if you're not in a position to have the organization set goals, then set your own goals. What does success look like for you in 6 months? What are the things that you, as a student, as an emerging healthcare professional, as an emerging leader, what will be your own measures? And don't just think about it like idly while you're sort of watching something or making dinner. Like write it down. And write down, like, these are my 5 goals that I want to achieve in the next 6 months. And it's not just about getting straight A's. It's about all these other things. And then say, how are you going to get them? And hold yourself accountable. That's what good leaders do. So set your own goals and really encourage your organization to set a broader set of goals as well. If you're in a leadership role, is broaden the definition of success and do it together.
I love that, working backwards, you know, figure out what matters, and then you work back to what do I need to do now to get there. So Love it. No, there's lots more questions in the chat. Here we go. Molly. Dr. Tepper, how do you deal with the differences between the politics and the policies with what is going on to get positive outcomes during this type of pandemic to get successful outcomes? What strategies?
Yeah, I mean, she's not in the room, so I can say this. This is where my wife and I often disagree a little bit. You know, I think 2 or 3 thoughts. One is, I think we live in a publicly funded healthcare system. We live in a democracy. And so those 2 things come together to mean that politics has a huge shaping of our response and our policies to the pandemic. And so we cannot separate the politics and the policies, because the politics in a publicly funded democratic system drive our policies. And we saw that with the announcement yesterday by the Premier, right? So we can't pretend there is not a very close connection. What I think I try to be very mindful of is that nobody has the answers. No leader is perfect. These leaders are struggling with the same tensions and others that I've talked about today. And I think I try, partly for my own mental health, if you will, I use that word in sort of a general sense, and partly because I think it's who I want to be as a person, not to find myself engaging in a lot of criticism of politicians and leaders, and recognizing and stepping back and saying, like, man, it's got to be one of the hardest jobs out there, is leading whatever they're leading that I feel is generating the politics that I disagree with or may disagree with their policies. And what I try to do is I really try to say, you know, what drove this decision? What are the other data points that they have? You know, I worked in government for a long time. And I remember briefing the Premier once, doesn't matter which Premier, but I had a chance to brief the Premier often, actually. And, you know, and I brief ministers still every day or every few days. You know, one thing that I'm always reminded by is my data points are here. Their data points are here. And they're having to make decisions with a far broader set of data points and a far broader set of considerations than I have to make in bringing my policy issues and my policy recommendations to them. And so I try to think about what are the things they're hearing, reading, seeing, what are the other factors in their decision making. And this could be a politician, this could be a CEO, this could be a chief of a department, it could be an association leader. What are the other data points that they're having to balance again to help me understand what are the politics and the policies that are influencing the outcomes that I'm seeing? It may not mean that I agree with it, but it may open my mind to at least better understanding. You know, I don't have to agree, but if I can come to a better understanding of your decision, it's very, I think it's a healthier place to be than raging in frustration and anger, which is sometimes what you just see in the 140 characters on Twitter. And it builds empathy, it builds understanding, it builds connectivity between leaders and followers, and it actually builds knowledge, right? It actually builds knowledge, which is important to me as a leader. And so I think those are some of the things I really try to do is avoid binary thinking, step back, be empathetic, sympathetic, and try to learn and understand and read between the lines about what else is going on. Molly, I don't know if that helps answer your question, but
I think so. You know, with some comments in the chat box, you know, kindness, support, and understanding should go up to leaders. Also, that was from Stephen Patton, one of our past presidents. I think it's a good point. I think we need to think that way, regardless of who we're you know, interacting with or evaluating how they're responding to something. Difficult time for everyone. So thank you. That was our last question for the session. I really appreciate you taking the time to spend with us early Saturday morning. I'm sure things are very busy. Lots of takeaways, honestly. I don't know if you guys could see me. I was taking notes while you were chatting, but two big things that I think resonated with other people too, as I could see in the comments box. Anticipate, communicate, mitigate. Like, great, right? Great way to think how to approach things as leaders. And then I know your discussion about the safety rope. Honestly, I have an image in my head right now when you put it the way you did, that, you know, having the safety rope at the time only when you're falling, it's way too late. We need to think about it ahead of time, but both personally and professionally. You know, do we have those things in place? Have we thought about what we need to help get us through that? So thank you for challenging us to kind of think differently about that. I think it'll help us for sure. And I can see lots of people saying that they appreciate your time and you being here. So again, thank you so much. Wishing you and your family all the best through this crazy time that we're living.
Thank you for all that you guys are doing. I know whether you're seeing patients who have COVID or patients who have so many other of the medical and physical conditions that you treat with your expertise, your skills are so desperately needed. And thank you, and keep yourself safe and your family safe. Be well. But I always conclude a talk on leadership by saying the leadership community is very, very small. And so let's stay connected. I'm easy to find on social media, on Twitter specifically, my email. Reach out, connect, and let's have the conversations that get us through this together. And again, be well. Thanks for having me today. It was so kind of you.
That's great. Thank you so much, Dr. Tepper. All right, everybody. So that was our great first session. Great way to start the day. So we've got 15 minutes. So starting at 9:15, we'll have our first panel, Sit and Let's Chat, a conversation with Black PTs and a call to action to end racism. Be sure to check out the agenda to find the broadcast link, and we will see you all there shortly. Thank you so much.